Okay. All right. So today we'll be talking about Medicare. This is really geared more towards the human resources professional or someone who is playing that role for an employer. We will go over a lot of basic information about Medicare, but really what this is aimed at is helping you understand from your position how better to guide your employees without you having to be the expert on that topic, because it's a rather confusing topic. You have to know enough in your role. So two things here. We want you to know that you have a resource in HGI Solutions, Henriot Group, for Medicare if you or any of your employees have questions. Or the other thing is just a few of the basic things that will help you along the way make sure that you can answer a few of the simple questions, okay? So hopefully you can all see the Medicare 101 cover page here. If you can't, please let me know. I will have the chat window open here. So if you do have questions, don't hesitate to type in a question there or jot it down, because I will stop periodically and you can always type it in then. And then at the end, of course, I'll make sure that if you have questions, I get those all answered, okay? So with that, we will get started on the topic here. All right. So this is our team at Henriot Group. We have Marlene and Wendy who also assist. We get a lot of phone calls on a regular basis, especially coming up here in fourth quarter. So just know we have a whole team of people set and ready to help you. If you need to reach out to us, don't hesitate. You can always call our main line and get the Medicare team at extension 3, okay? So what is Medicare? Medicare is a federal health insurance program. It's for people who are 65 or older, okay? And that's really the area we will mostly be focusing on today. Now, some people do qualify for Medicare if they have a disability. So if someone has been receiving a Social Security disability check for at least 24 months, then they will automatically receive a Medicare card with their benefits, okay? So at that 24th month, they will qualify for Medicare if they are receiving Social Security disability. Also, a person qualifies if they have end-stage renal disease as well, okay? So just know that the ESRD factors, it gets a little complicated. Even I have to look them up in the book because there are some 33-month rules and so on, and it has a lot to do with the size of the employer on who would pay first, okay? So today we will mostly be focusing on Medicare eligibility at age 65. I do like to touch on what the difference is between Medicare and Medicaid. A lot of people will say, oh, I need to get signed up for my Medicaid. Well, that's very different from Medicare. Medicare is not income or asset based in order to qualify. Now, there are some features about Medicare that could cause you to pay more for it if you do have a higher income. And those are things that I would go over with people when they get ready to transition. But Medicaid, think of it this way. It is aid for people who lack resources and income, okay? So the state would have to make that qualification for someone to become Medicaid eligible. Right now, anyone on Medicaid is going through a Medicaid redetermination. It started in April of this year and will be completed in April of next year. So every person on Medicaid is going through that redetermination to make sure they are still actually eligible, okay? Parts of Medicare. So we have A, hospital coverage, and then B, your medical coverage, which is where doctors and outpatient services come into play. A and B are what they consider original Medicare. Okay, so if somebody says they have original Medicare, they have A and B. You have to have A and B when you get ready to transition and lose employer coverage. Everyone would have to have that in order to pick up additional coverage. Okay. Now, C and D came about in 2006, basically as a means to help provide people with an option for specifically drug coverage, but then also if they needed additional coverage to pick up what Medicare does not, if they didn't realize they had a finite period of time to enroll in a Medicare supplement. Okay, so we'll get into a little more detail on what those look like. Just know C and D are additional options that came about in 2006. A and B is the original Medicare benefit. Part A, as I mentioned, covers hospital care. It will cost most people $0 to have Part A as long as they had 40 quarters of working time where they paid Medicare taxes. Okay, so it would cost them $0. If someone did not have their own working quarters, but they were married to someone who has those qualifying quarters, they will still qualify for $0 Part A. Okay. Now, it doesn't mean that you don't pay anything when you go to the hospital. So you will see here for the first 60 days in the hospital, the deductible is $1,600. So that is if someone is admitted anywhere from 1 night to 60 nights, they will pay the first $1,600. Now, days 61 through 90, they begin a copay of $400 a day. And then if they get into days 91 through 150, there is a copay of $800 a day. Those days 91 through 150 are considered lifetime reserve days. So for example, if someone is in the hospital for 100 days, they use up 10 of them, they have 50 days to use beyond the 90th day of a consecutive hospital stay later in their life. Okay. You also have hospice care covered under Part A. It's actually covered very well. And then you have blood as far as transfusions, but each calendar year a person is responsible for paying for the first 3 pints of blood. And then you have some minimal amounts of skilled nursing coverage, potentially 100 days of skilled nursing. You have to have had a 3-night admitted hospital stay and go directly to the nursing home. Now, this is really intended for intense rehab. Somebody just needs to recover. Maybe their home is not set up so that they can recover appropriately there. Maybe they don't have any help, and they will send them to the nursing home. Days 1 through 20 are covered very well, but then days 21 through 100 would have a $200 a day copay. So just keep in mind, Medicare does not cover a chronic long-term care stay. People get that really confused, but it's not a chronic long-term care stay that will cover that. Okay, will be covered by Medicare. Some people do have to spend down to Medicaid once they're out of money, so that's very different. Okay, so original Medicare Part A here, and then we have your Part B benefit. So Part B has an annual deductible of $226 currently. So if somebody is having claims under outpatient or doctor services, they will pay the first $226. Then Medicare begins to pay 80%, and you would pay 20% of those claims. Now, Part B does have a premium. It's $164.90 a month, and that is the current Part B premium. That number does adjust each year, just as all of these numbers on this page will adjust with the calendar year. Now, I have a note there that says IRMAA. We call those IRMA charges. I mentioned before, if someone was a higher wage earner, they always do a 2-year look back on income. They get the data from the IRS, and Social Security will then assess you an IRMA charge for being a high wage earner 2 years before. So if someone is enrolling right now in 2023, they would look back at 2021 taxes. A couple that is filing a joint tax return, if they made more than $194,000 2 years ago, they will pay more for Part B. So if you have anyone who's needing that chart, I'm happy to share it. All the information is also out on socialsecurity.gov. Okay. Now, Part B, something to know is that there is no maximum out-of-pocket limit, not with Part B or Part A. So these numbers can go on infinitely for the calendar year. So that's typically why people pick up additional coverage. Enrollment into Part A and B is done through the Social Security office, okay? One thing that I would definitely encourage you to tell your employees if they're starting to think about retirement is to set up an SSA.gov account, okay? Get that set up, get it out of the way, because currently the 3 ways to sign up for A and B are to go to an office, go online, or set up a phone appointment. And right now, if you go to an office, the feedback I'm getting is that people walk in and they will say, we don't have the manpower to help you with that. Here's a sheet, go online and do this. Or you need to call and make a phone appointment, and they're roughly 40 days out on most phone appointments. So just keep that in mind. We'll be going over a time frame that your employees have to transition, but that's why I would encourage everyone, go ahead and set up an SSA.gov account if they have any comfort on a computer, okay? Now, Part B, I do want to note to you, that is one area where there is potentially a penalty that can occur. And that penalty for Part B is that for every 12 months a person should have had Part B but did not enroll, they will pay an additional 10% premium on top of the Part B base. If they have an IRMA charge, they'll pay an additional 10% for that, okay? Now, how can someone avoid the Part B penalty? Stay on the group plan until they retire, if they're over 65, okay? Take Part B at 65. So if someone is retired, even if you offer retiree coverage at your employer, then you typically at 65 must pick up A and B and transition to Medicare at that time, okay? It's very rare that you could stay on the group plan if you're already retired. But if you stay on that group plan, it doesn't matter what type of group plan, if it's one with a high deductible and an HSA, or if it's just a copay style plan, you will avoid the Part B penalty. And then I always say, just be mindful of election periods. Most people reach out to us about 4 to 6 months prior to turning 65 to make sure they're not making errors for themselves, okay? So just keep in mind the Part B penalty will not occur if someone has any type of employer coverage. So that's important for you to be aware of if your employees are asking you that question. Okay. All right, Part C. These are Advantage plans. I'm just going to brush over them right now because they're part of they're part of the 4 parts of Medicare, but they're private insurance that pays instead of A and B. However, you have to be enrolled in A and B to get a Medicare Advantage plan, and most do incorporate the drug coverage into the plan. Those that do not are typically for people who have veterans benefits and use the VA system for their medications, okay? These plans have networks, they change yearly. They're structured very similar to a copay style plan through an employer, okay? They are required because they're a contract with the government to cover at least what Medicare A and B cover, but they're not required to cover the out-of-pocket amount that Medicare doesn't cover. But they must have an out-of-pocket maximum. That's a requirement. So on these plans, if I'm working with someone, I'm going through and checking networks. We're talking specifically about how they work and differ from being on original Medicare. They're oftentimes referred to as replacement plans. Part D. Part D is your prescription drug coverage. So many people will just get a standalone drug plan, or I mentioned that in Part C, most of those incorporate the drug plan into it. Part D plans, they only cover FDA-approved medications picked up at the pharmacy. They don't pick up costs even for prescription vitamins because there are over-the-counter options there. So those are some things that people need to be aware of. Part D does not cover chemotherapy or immunotherapy. That is covered under Part B. These again change yearly, and people can change their plan during open enrollment. So Part C and Part D are the only two options that can be changed during open enrollment. People do not have to re-enroll in A and B each year. They don't have to change their Part C or Part D or a supplement. We'll get into that. But it is important to have that reviewed, okay? Now, the bottom statement here, a penalty can potentially occur if someone does not have qualifying drug coverage once they turn 65. So let's get into some specifics here, because this is where you will also come into play. In your role, what I want you to note is the bottom statement. Provide your employees with a creditable coverage notice if your group plan covers medications as well as Medicare, okay? So even if it doesn't, you have to let them know if it's not creditable. Many times this notice is sent out by the actual insurance company, but oftentimes the employer sends it out. This is something that you do need to be able to answer. If you don't know if your drug coverage that is attached to your employer plan is creditable, you need to check with your benefits provider, okay? Now, creditability, what it means is that your drug coverage on your employer plan covers medications as well as a Medicare standalone drug plan, okay? And that's just determined by CMS, Center for Medicare and Medicaid Services. All the group insurance companies, you know, your Anthem, United Healthcare, Cigna, Aetna, and so on, will have them reviewed by CMS to determine if they're creditable, okay? If your coverage is not creditable and they go to move to Medicare, say at 67, they could incur a penalty for 2 years of not having drug coverage. Or I have people who retire and they say, I don't take meds, I'm not enrolling in a drug plan. So they could be penalized if they retire and they don't pick up drug coverage at that point, okay? Now the penalty is 1% of the national average cost of a drug plan, which right now is $31.50. So 1%, 0.315. And they take that times the number of months someone went without creditable drug coverage. And then that penalty is charged to you once you do enroll in a drug plan, and it is charged every month the remainder of life. So this is where it's very important from your role to know whether or not the drug coverage attached to your group plan is creditable. You need any more guidance on that, need an example of a creditable coverage notice, let me know. I know you can just Google that and make sure that your employees are receiving that document, okay? All right, moving on. I don't see any questions here, but don't be shy if you do have any. Next thing I want to cover is who pays first. So from your perspective, if you have an employee who has already enrolled in Part A, so maybe they're 65 or older, they've taken Part A only, okay, to cover hospital costs. If there are 20 or more employees, per Medicare law, the group health plan will pay first. Medicare will not pick up until the group health plan has paid. If there are fewer than 20 employees, then Medicare would pay first, okay? So Medicare would be the primary payer in that situation. Now, I mention this also because oftentimes people will pick up Part A only because it's $0 in cost to them. But occasionally I have people who go ahead and pick up Part B and they're not retiring. If the employer has 20 or more employees and the group health plan pays first and they're over 65, there is no reason for them to pick up Part B and be paying that premium. They will not get enough benefit out of paying that premium and having Part B. However, if there are fewer than 20 employees, they generally always have to pick up Part B. Every health certificate I have read since 2014 requires them to have both A and B because Medicare will pay first if there are fewer than 20 employees. Okay, so keep that in mind, who will be paying first. Okay, you may also have employees, if you have a 20 or more group, that have not picked up any part of Medicare. And we'll go into it a little later why that may be, because they actually don't have to do anything as long as they have qualifying employer coverage and there are 20 or more employees. Okay. Now, I want to brush over who pays first if someone is under 65. So this would be a situation where someone is receiving Social Security disability and they've automatically been enrolled in Medicare because they've been receiving that for 24 months. Now, in most cases for an employer, it's going to be the spouse of an employee. I rarely find that it's the employee themselves that have qualified for disability and then stayed working. So just know that the rules are similar, only it's 100 or more employees or fewer than 100, which determines whether Medicare pays first or the group health plan pays first. So just know in that scenario, if you're under 100 employees and you have a spouse on disability, they typically need to keep their Part B benefit. So they would have to have A and B along with the group plan. Okay. Again, if you have more questions on this topic, let me know. I am going to pause here just a moment, make sure I don't see any questions here. If someone would rather ask one live, you're welcome to do that. But if I don't see anything pop up, I'll go ahead and move on to the next topic here for you. Okay, so let's talk about when your employees can sign up, okay? So they are eligible at 65. If they are still planning to work, then they may not need to do anything at all yet, especially if you're 20 or more employees. Now, if they are retiring, here's the window of time to consider. So people are eligible for Medicare the first of the month that they turn 65. So if a birthday is on May 15th, their Medicare benefits begin May 1st. They don't begin May 15th. They don't begin at the end of the month. It's May 1st. It will simplify their life if they just plan to move then May 1st if they're retiring upon Medicare eligibility. Now, they have a 3-month window before that they can take care of everything, and benefits would start the first of the month they turn 65. If they wait until the month that they turn 65, then their Part B will start the following month. If they enroll in the 3 months after, which is also part of their initial enrollment period window, their IEP window, then Part B begins the first of the month following the month that they go through the enrollment process. And again, they're enrolling through Social Security, okay? So just keep in mind they have a 7-month window to get enrolled and they need no additional paperwork to do this, okay? Also, I do want to note here, if you have someone who is born on the first day of a month, they're actually eligible to begin their Medicare 1 month early. So say a June 1st birthday, they would be eligible May 1st to start Medicare, okay? So again, this is typically why I will see people who call us. We have a 15-minute phone call about 4 to 6 months prior to turning 65. Okay. So moving on, let's talk about something that really may impact you in your role. When you have people, they come to you, they're 65, they're not retiring, they want to retire in a couple years, okay? They will be granted a special enrollment period, okay? That enrollment process can then begin 3 months prior to their desired effective date, okay? Now, here's what you need to know from your role, okay? If a person retires and they are leaving employer coverage, do they lose coverage on the last day of employment or on the last day of the month in which they are employed? Okay, because that's very important. Part B can only begin the first day of a month. Okay, so if they're retiring on the 5th day of a month and they lose their employee benefits on the 5th day of that month, they may want to start their Part B the first of the month they're retiring. But their additional coverage that we'll be going over, so supplement, Part D, Advantage plans, they cannot overlap with group coverage, not even one day. So A and B can overlap with group coverage, but any additional coverage cannot. So it is very important from your role to be able to answer to someone when they choose their retirement date, when will their last day of health insurance be? And they may want to plan that strategically so that their Part B begins the first day of a month after they've lost their coverage on the last day of a month. Okay? So just want to keep that in mind. Now, if someone is retiring and they actually have 8 months after they lose their employee coverage to pick up Part B, okay? So they have 8 months to do that. But what people have to keep in mind is you will have a penalty if you go more than 2 months, more than 63 days without qualifying drug coverage. So it's important that they use that window of time wisely. I tell people all the time, start the process 3 months before you know you need your Part B and additional coverage, and do something within 2 months so that you avoid any penalties, okay? So let's give you an example. So this person, group coverage is ending on May 31st. They want to start their Medicare June 1. 3 months prior, in March, there are forms that they will have to submit to Social Security in order to get enrolled, because at this point they're over 65. Social Security needs proof that they have had employer coverage. Those forms cannot be handed in more than 90 days prior. So that's where this 3-month window for the special enrollment period comes into play. Okay, some people want to get a head start on it, good, 7-8 months early. Not possible. It will sit on a desk and be lost. They don't want the employer verification form dated more than 90 days prior to submittal. Okay, so just keep in mind, this person, they would definitely want to do something no later than July to make sure they're also avoiding the Part D penalty. Okay, it's very important to use this time wisely. Now, I want to go over the request for employment information form here, okay? So this is an L564 form. It's a Social Security form. It is something you will need to fill out. So as the employer, okay, you can see here at the top is the employer's name and address. And then number 4 would be the applicant, and number 6, the employee. If the employee is the one needing to pick up Medicare, their name will be under both 4 and 6, and their Social Security number will be as well. If it is a spouse that you're needing to provide proof that they've had health insurance since at least age 65, then the spouse would be the applicant, and then you would list the employee. In most circumstances on the bottom, you will be answering numbers 1, 2, 3, and 5. 1, have they been covered under the employer health plan? Typically, And you will, by the way, be answering it as of the date you're filling it out. So typically this would be yes, because they haven't retired yet. If they have, then it would be no, but typically yes. When did the coverage begin? Again, it's very important. You put when they started coverage. It doesn't matter if they currently have Anthem and it was United Healthcare 2 years ago. Was it Cigna at some point? When did they start having health insurance with your company? This date needs to get them prior to age 65 if they've had employer coverage since at least age 65. Okay, so keep that in mind. If I have had situations where someone worked at their own employment, they had their own coverage until 67, they moved on to a spouse and was there from say 67 to 70, they would need 2 of these forms completed. Okay, so that's an important thing to know. Now, number 3, has coverage ended? Typically, this one is no, because you're filling it out prior to retirement. Skip 4, unless coverage has ended. And then number 5, when did the employee work for your company? Generally, you'll be filling out the from date when they started working there. It may or may not be the same as the date number 2. And then you will put a still employed. So if you're filling this form out right now in September of 2023, you would put 09-2023. You do not put, if that person is retiring the last day of October, you do not put future dates on this form. So you would not put 10 of 2023. You would just put a from date and a still employed date. Okay. Again, if it was somebody who'd already retired, then yes, you would use that. Okay. Typically, I never see number 6 or the 4 hours bank arrangements filled out. Okay. So just keep that in mind. This is something you'll need to complete. Fill out the bottom by signing, providing a phone number, date, and title. Okay. If you need help with this form, don't hesitate to reach out. I do have this form I can always send to you. Okay. I also want to share with you another document in the CMS 40B. This is a document that the employee would be filling out. They will have to submit this with the employer verification form only if they already have a Medicare number. If they do not have a Medicare number, they have to apply online or set up a phone appointment or go to the office. And then they can submit this and put their reentry from their online. But this form is really intended for people who already have a Medicare number to submit with the employer verification so that they can pick up Part B. Okay. Something that I didn't mention before was that separate forms are needed for the employee and spouse. I mentioned how to fill that out, but make sure they each have their own form. Okay. All right. I don't see any questions, but again, don't be shy. Oh, wait, I'm sorry, I do have one. Does the Part D penalty stay in place for the remainder of a person's life, or does it drop at some point? The Part D penalty lasts for the remainder of a person's life, so it will not go away, okay? So just keep that in mind. It will not go away for someone who's assessed the Part D penalty. Okay. Next topic. I get a lot of questions around this. How do health savings account plans work with Medicare? So first off, I need you to know from your perspective, if someone is eligible for Medicare, they can still be on the health plan, even if it is an HSA qualified plan. What they have to be aware of is that they need to stop their contributions. But I realize from the company's perspective, you're required to treat everyone the same, and they may be continuing to get their health savings account contributions. What they need to know is that those will become taxed for them. So they will be taxed at their ordinary income tax rate. And for a 12-month period that they've been contributing. And if they continue to contribute, they will pay a 6% penalty. Okay? So it's not that they can't be on the health plan, it's that they have to think about those contributions. If they have a spouse who's under 65 and they picked up Part A, they could contribute up to the individual limit without worrying about the penalty. Okay? Now, what is important to know is if someone is continuing on an employer plan, they're over 65 and that employer plan has 20 or more employees, so 20 or more noses employed by the company, they do not have to pick up any part of Medicare. It is not required. They don't have to pick up any part of it unless they are collecting Social Security, and then they would have to at least take Part A, okay? They would not be able to decline it, okay? So it's just important to know, basically, Part A doesn't like HSA, okay? They don't go together. The government considers it double dipping. Part A is a government plan for hospital insurance. HSA dollars, you're getting tax advantaged money there, okay? So it's not that they can't be on that health plan, but it is that they have to be very aware of what happens to HSA contributions and the penalty. It is also important to know if someone is retiring past age 65 and they've not enrolled in Part A so that they can continue to contribute to the HSA account, okay? When they go to enroll in their Medicare benefits, Part A will be backdated 6 months. There's no way around that rule. So if they're retiring at the end of a calendar year and they're trying to get in as much of their contribution as possible, okay, well, their window to enroll for January 1 would open October 1. They go through that process in October, okay, their Part A would then be dated April 1st, meaning they technically can only get full contributions up for those 3 months, so 3/12 of the maximum HSA amount, unless they have a spouse under 65 on the plan that they can take full advantage of the spousal amount of contribution as well, okay? It's very common for me to have to run calculations to help people sort out how much they can contribute here. No one's going to jail over this, by the way. It's just that they would have to pay tax on that money. And if it's more than a 12-month period that they continue to do this, they'll pay a 6% penalty now. Okay? So a couple things to keep in mind with that, with the HSA and Medicare. Okay? All right. I'm not seeing any new questions here. So I'm going to go ahead and move on so that you have an idea for your employees what it would cost for someone to move to Medicare. So I get that common question. Someone will say, I'm planning to continue to work, okay? Should I move to Medicare? Would it be better coverage? Would it be less expensive? What do I need to know? So we're going to go through so that you have a rough idea how these coverage options work and what they cost. But if I had to just put it between a couple brackets, right now, if someone moved to Medicare, if they did not have any income-related monthly adjustments for having higher income 2 years ago, then they would pay roughly between $165 a month and $330 a month for Medicare coverage. The higher premium you pay, the less you're going to have out of pocket as you need care. The lower premium, the more you would have out of pocket as you need care. That's where they would have to make some decisions on what type of coverage that they choose or want to have. So basically, we're going to look at two options here, Medicare Supplement and Part D, or Medicare Advantage plans to give people an option for full coverage. Option 1, Medicare Supplement, it's also known as Medigap. You'll see a whole alphabet soup of coverage here, okay? These are standardized by the government. Any supplement plan or Medigap plan allows someone to see any doctor they want that takes Medicare. Doesn't matter if they're in Indiana, they're in California, or any other state that takes Medicare, along with the 5 territories that take Medicare. Okay? So any doctor can be seen. What we typically see here, because anyone born 1955 and later cannot get into C or F, if someone is looking for the most comprehensive coverage, they're going to look at Plan G. It covers everything but the Part B deductible, which is $226. We also have a G Star, which is a high deductible G, where they have to pay the first $2,700 towards the costs under original Medicare A and B, and then the plan would pick up 100%. Okay, so back under Part A, where they have a $1,600 deductible, if they get admitted, they would pay that $1,600. It would count towards the $2,700 maximum, and then the plan, once they would meet $2,700, would pay 100%. Now, in our area and in most states, G and N are going to be the best value for the dollar. N is very similar to G in the sense that it will pick up all the costs not covered by Medicare under Part A. It will cover the 20% under Part B. It requires you to pay that Part B deductible of $226. The difference on N is that it does have some copays, $20 for primary doctor visits. It has a $50 copay for an emergency room visit if you're not admitted. And you do have the potential to pay excess charges if someone chooses to see a doctor that doesn't contract to take Medicare, but they see that doctor for something Medicare covers. I do want to say if someone enrolls in G and N do not have to pay if original Medicare A and B do not approve the charge. Okay, so they can't go and have cosmetic surgery because it's not approved by Part B or Part A and then have it covered by the supplement. Only things covered by Part A and B and approved will then be picked up by G or N or any of these plans depending on what they choose. Okay, so they would choose a supplement and then they would have to choose a drug plan to go with it to make sure that they're avoiding that penalty. Now, what we do at HGI Solutions is we get someone's zip code, their detailed list of medications, the pharmacy they use, and we go through and enter it into the Medicare.gov plan finder and help someone determine how can we make sure they're not spending more money than they need to on medications. Okay, so we help them determine their lowest cost for drug coverage. Every year they have an opportunity to switch their drug plan. Okay, so they have an opportunity to switch their drug plan each year. Now, back to this, supplemental plans do not have an annual enrollment period. They have 6 months to pick up the supplement plan, guaranteed, no medical questions. If they ever want to change that plan, they do have to answer medical questions. Okay. And then again, the Part D would go along with it. We have here an example, just so you have a concept on pricing for these plans. These are very specified, whether it's male or female, what is their age, are they a non-smoker or smoker? I have plugged in the average Part D premium, okay? In Indiana, the premiums actually run to less than $5 to over $100. It all depends on what medication they're taking, okay? This is Plan G, so their only out-of-pocket would be $226. This is a high deductible G, so you can see it's a lower premium. If someone is looking at N, you're going to be looking a little closer to these premiums that you have under G. Generally, it just depends on the carrier. Some Plan N options will be, only a few less dollars a year. Others can be 400 or 500 less a year. So that's where we would be going through as an independent agent. I'm contracted with a lot of carriers, try to show them all their options for pricing there. Okay. So just keep this in mind. This is really, high-end, most comprehensive coverage, which will get them more premium, but less out of pocket. They would be able to see any doctor that takes Medicare. Okay. Option 2, Medicare Advantage. So this is Part C. This is where private insurance pays instead of your original Medicare A and B, and most wrap in the drug coverage. Now they have to still be enrolled in A and B in order to pick up an Advantage plan. Claims would then go through the private insurance company. They're required to pay at least what original Medicare A and B cover if they're in network, but they're not required to pay their portion. Okay, so for example, in that hospital coverage where I mentioned under original Medicare, it's $1,600 for a stay anywhere 1 to 60 days. With these, they'll just restructure the $1,600. They'll say it's so much per day for the first 5, 6, 7, or 8 days. Okay, so they create a copay for those days if they're in network. Okay, they're not required to pick up the portion that's not covered by Medicare. Okay, they just restructure it. Many people refer to Advantage plans as replacement plans because you're replacing the schedule of benefits under original Medicare. But they are required to have an out-of-pocket maximum. The doctors not only need to take Medicare, but then be in the network in order for the person to pay the least out of pocket. Some of these plans will be on a preferred provider organization model, a PPO. Others will be on an HMO for a health maintenance organization model. We have a few under what they call PFFS plans. Those are where the doctor would just have to accept the plan. We don't see very many of those in Indiana. Okay. These can be changed every year. Okay. A person can be in, say a United Healthcare plan and move to Anthem. They could move to IU, whatever they would want year after year. Okay. Do know that if someone is in option 1 with a supplement in Part D, they can use annual enrollment period to get to a Medicare Advantage plan. Once they have been here longer than 12 months, they are not guaranteed the ability to go back to a supplement. They would have to answer medical questions, okay? Because annual enrollment period would only allow them a guaranteed option to go back to Part D, not to a supplement after that, okay? Most of these plans have added perks like dental, vision, gym memberships. On the supplement side, there are very few of them that offer those extras. But that's one thing that people like about the Advantage plan is the extras. In the last few years, we have seen some major changes in these with a lot of added extras and lower out-of-pocket maximums. But keep in mind, it's definitely a philosophy choice for the employees. But hopefully this gives you an idea what to expect. So I mentioned earlier, if someone is coming into you and saying, hey, do you know what it would cost for me to move to Medicare? You can say $165 up to $330 currently. These are $0 plans, okay? So it's a $0 premium, okay? You see different deductibles for medicines. It just depends on the structure. They'll all have a maximum out-of-pocket limit that they have to set. Again, these are structured very much like copay plans through an employer, and they have to keep their Part B benefit and be paying for it, and any IRMA charges. I've had people come in and say, well, I want to move to an Advantage so I can get rid of my IRMA. That won't happen. Okay. All right. So hopefully that helps. I know we're nearing the end here. I have a couple of things to cover. So want to make sure that your employees know where to go. Okay, so the next steps, if they're wanting to do something, I would definitely encourage them right now to set up an SSA.gov account. Okay, get that off their plate, have that login, make sure they know what it is. If they're transitioning to Medicare, the Medicare.gov system, that's where we go to help price plans, look at things like C&D. You'll find minimal information on supplements. As an agent who is an independent, one thing that I can tell you is you can see pricing for supplement plans, but very few carriers will let you enroll without an agent. Okay. Any agent who is certified to work with Medicare plans cannot charge a fee to be assisting people. Okay. If someone is charging a fee, they generally just have a life and health license and they're not certified to write Medicare plans. Okay, so that certification means that they can write C&D, and that's what we use the Medicare Plan Finder to determine and help someone pick their best plan, but we cannot charge a fee for that, and anyone certified could not. Okay, but to enroll in A and B, that's always done through Social Security. A lot of people go to the Medicare.gov site for it. If you go there and you find the information, it'll circle people back to socialsecurity.gov. Okay, so great resources here, but of course, we're happy to answer any questions. All right, so want to go through some contact information here real quick. If anyone needs to reach out to me or Marlene, Wendy's also always there supporting us, but you can call our main line and hit option 3 as well as the direct numbers. We do have a texting feature and a direct email. If anyone has questions, they need to get out to us and make sure that any of us see it. Okay, so we try to always make sure we're very available. It gets to be hectic during fourth quarter, but we do our best to try to respond in a timely manner there. Okay, so I want to make sure everyone has our contact information. Any last questions before I pull up the program ID for your continuing ed credits? I'm not seeing anything additional on the Q&A. But if you need any information, don't hesitate to reach out.